Would Punjab ever see a quota here, wherein KOTA, so wherein students have government specialized facilities to study for NEET, because that's the most difficult exam of our country. We all know that, we all respect that. And secondly, more hospitals, more on the parameters of PGI, sir.
Definitely. I said earn while.
So when there is a government initiative and private doctors are supposed to be a part of it, yeah, compulsorily or semi-compulsorily, sir, it puts a lot of added burden onto the doctors. So what special incentives or things that government has in their mind so that doctors are willing and not disgruntled? Your city, Patiala, so Rajendra Hospital, in comparison to any good private hospital, and now that we're sitting in Ludhiana, so two hospitals that would come into comparison, instant comparisons are DMC with CMC. So to bridge the gap, it's really important. Otherwise, also your vision of how do you want to bridge the gap between private and public here?
It's a good question again. You see, there are many ways. You have mentioned one. So first thing is that government hospitals, they need not to be inferior to, they should be as good as the private hospitals.
Absolutely.
ਦਾ ਸਮਰ ਨਿਊਜ਼ ਦੇਸ਼ ਦੇ ਵਿੱਚ ਤੇਜ਼ੀ ਦੇ ਨਾਲ ਅੱਗੇ ਵਧਣ ਵਾਲਾ ਚੈਨਲ ਅੱਜ ਚੈਨਲ ਦੇ ਵੱਲੋਂ ਇੱਕ ਖਾਸ ਪ੍ਰੋਗਰਾਮ ਕਰਵਾਇਆ ਗਿਆ ਹੈ ਹੈਲਥ ਕੇਅਰ ਐਂਡ ਬਿਜ਼ਨਸ ਕੌਨਕਲੇਵ 2025 ਇਸ ਦੇ ਵਿੱਚ ਸਾਡੇ ਖਾਸ ਮਹਿਮਾਨ ਪਹੁੰਚੇ ਨੇ ਪੰਜਾਬ ਕੈਬਨਿਟ ਮੰਤਰੀ ਹੈਲਥ ਮਿਨਿਸਟਰ ਡਾਕਟਰ ਬਲਬੀਰ ਸਿੰਘ ਜੀ ਪੈਨਲ ਦੇ ਵਿੱਚ ਮੌਜੂਦ ਨੇ ਸਮਰ ਨਿਊਜ਼ ਦੇ ਡਾਇਰੈਕਟਰ ਮਿਸਿਸ ਪਾਇਲ ਮਹਿੰਦਰਾ ਤੇ ਮੈਂ ਉਹਨਾਂ ਨਾਲ ਹਰਸ਼ਦੀਪ ਸਿੰਘ मैडम मैं गुजारिश करांगा कि आज का प्रोग्राम शुरू कर दें सर तो सवाल लेने
थैंक यू जी एम आई ऑडिबल बिकॉज पहले कंप्लेंट्स आ रही थी कि पीछे आवाज नहीं आ रही एम आई ऑडिबल एट द बैक वेल लेडीज एंड जेंटलमैन आई थिंक इट इज आवर प्रिविलेज टू हैव सर हियर विद अस who not only is the cabinet minister of health and family welfare, but also is a distinguished doctor himself. So on behalf of the entire doctor fraternity, sir, we welcome you and let's have a huge round of applause, sir. Thank you.
Thank you very much. Thank you.
So my first question to you is, in fact, I have three questions here, one after the other. So first question is, sir, you are a doctor yourself, a renowned ophthalmologist. And so let's talk about first the studies of a doctor. We start with NEET. So it is usually said it's an inverted pyramid. So for MBBS, the seats are more and they are visibly reduced and shrunk and becomes an inverted pyramid. And once you gain those degrees, you become, you have MBBS, MD, super specialization, then it's again a task uphill to establish yourself. After doing all that, after dedicating your 10 best years of life to education, then you know that you're a doctor, you're committed, commercial aspect is secondary, and you give your best. Still, there is security threat to your life, to your property. So I hope you would have understood my point here, that when a patient or patient's family ransack a hospital or attacks a doctor, I think that is a big red flag. And I think representing all the doctors here, we must have some red zone for all those who attack so that they're listed. And next time when they approach a doctor, ऐसा नहीं है कि डॉक्टर बोले कि आपको हम ट्रीट ही नहीं करेंगे. Of course they can't do it, but they should know that they would be in the red zone if next time or for the first time they attack a doctor. So what are the preventive measures there?
Hello.
Yeah, sir.
So, good evening, my dear colleagues, and I thank Payal ji and Harsh ji and Summer News, and I think I understand you are launching Hindi and English papers also today.
Yes.
So my good wishes to you.
Thank you, sir.
And
Thank you.
I have a lot of my dear colleagues. So this is a very important issue for doctors, that is the safety of doctors. We have a law, prevention of violence against medical personnel, and that includes doctors, paramedics, anybody working in the hospital, and damage to the hospital property. I would like to share with you that Punjab is the best performing state as far as the violence against doctors is concerned. So that this law is, it makes sure that it's a non-bailable offence.
Yes.
So there has been many instances, but that was not violence against the doctors. It is the two parties, they fought outside, then they come to the hospital, then you see they fight again inside the hospital, they ransack the hospital. Now in this case, in the last 5 or 6 cases, they are all apprehended, they are booked under the non-bailable offences, and they are all in jail.
All right.
So that has a deterrence effect. And we are very strict about it. And this is for your information, doctors know it, that there is a Supreme Court guidelines that if there is any case of negligence against the doctor, so our civil surgeon is here, Dr. Ramanpreet is here. So we have a committee, we have experts, so anybody can lodge a complaint with the civil surgeon. We constitute a committee which has permanent members. We have a member from the IMA also. Then we have a subject expert. That committee independently will look into the matter and then only action can be taken. Now patient has many opportunities. They can complain to the doctor and we have taken action against our own doctors.
All right.
Wherever they were faulty. But there is a zero tolerance. Under no circumstances any violence is justified against the doctor. So we don't allow it. We are strictly implementing the law. My colleagues are here, I think they will bear with me, and even the PCMS has appreciated it, that we are very strict about it. Plus then we have the CCTV cameras, we have deployed security people also from the PESCO and also from the police at certain places. So we are going to strengthen it further. Yes. So there is a zero tolerance. Patient can go to consumer forum, patient go to criminal court, civil courts, patient can go anywhere but they can lodge a complaint. But the police cannot lodge an FIR against the doctor without the report from that particular committee constituted for the
Zero
purpose.
tolerance, sir. I think that is quite reassuring. And
another thing we have done is that we have matched our government hospitals with the nearest police station. So they have the mobile number of the SHO and also of the DSP. That facility is available for the private doctors also. Whatever your police station is there, you only have to call them. They will come there within 5 to 7 minutes. Somebody can come to hospital, but rest assured they will not go back on their feet.
Well, I think that's wonderful, sir. Thank you so much. That is the need of the
But I
hour.
repeat it, patients are VIP for us.
Yes.
We do everything. Our doctors,
Yes.
they donate their own blood if need be. We take care of them.
Yes.
Patients are the VVIPs in our hospital. There cannot be any hospitals without the patients.
Yes. Yes.
Doctors we hire,
Yes.
but patients they come on their own. So they are like, they treat us like God and we treat them like God, but absolutely no violence.
Thank you so much, sir. That's quite reassuring, I would reiterate. So coming to the next question, sir, if we talk about your city, Patiala, so Rajendra Hospital, in comparison to any good private hospital, and now that we're sitting in Ludhiana, so 2 hospitals that would come into comparison, instant comparisons are DMC with CMC. So to bridge the gap, it's really important. Like down south, there is a process wherein a private, not a doctor, but because they are busy, but at least the residents could help with the public hospitals as well. With that, they get more experience there as well, and the public hospital also has access to other doctors. Sometimes, because the availability of doctors could be an issue. So, otherwise, also, your vision of how do you want to bridge the gap between private and public here?
It's a good question again. You see, there are many ways. You have mentioned one. So, first thing is that government hospitals, they need not to be inferior to, they should be as good as the private hospitals.
Absolutely, absolutely.
And I am proud to say that starting from primary health care, every Aam Aadmi clinic, 881 of them, it is staffed with a doctor, with a clinical assistant and a pharmacist and a helper. Every day, 70,000 patients, they benefit from Aam Aadmi clinics, and we are going to open 200 more. Coming to the government hospitals, you see, Bhagwant Mann government and our leaders, Arvind Kejriwal, Manish Sisodia, health is our topmost priority. Number 2, education is also our top priority. So these are the 2 most important, I would say, indicators for human development. If you talk about human development index, then health and education are the most important things. Now coming to secondary care, You see, primary care, now we have 107 medicines available. That's why so many patients are coming. 47 diagnostic tests, including hepatitis, HIV, dengue, pregnancy. Now we have introduced WhatsApp integration. I am sure that not many private doctors, and some of them approached me that we want to replicate it. As soon as the patient comes to a Malla clinic, he walks out, he has a full prescription on his mobile that this is your disease, doctor has seen you, these are the medicines you are supposed to take, and then these are the tests has been done, then he'll get the test report. And if he's a diabetic or hypertensive, he will get alerts. Pregnant lady will say that you came for second checkup, third checkup is due, now you are diabetic, your medicine is due, your test is due, please come and get the test done. So patient will get regular alerts. I think you can say it's a very good service. In secondary care, we have all the medicines available. We are upgrading all our systems, including non-stop supply of oxygen, uninterrupted supply of power, or lifts are working now, washrooms are clean now, all the hospitals are being set in order. Now we have already recruited 325 doctors, they have joined us. We have recruited another 1,000 doctors. They will be joining this month only.
Sir, मैं सवाल करना चाहूँगा जिसमें आम आदमी
clinic. Coming to our clinic, so private doctors and we in the government sector, we share healthcare. So I think there are a lot of doctors from DMC. So we are running a project called STEMI, where 700 doctors were trained by the doctors of DMC, Government Medical College, Amritsar, Patiala, Faridkot, and Sector 32 also. So we have thrombolized 583 patients in places like Dr. Bishop Mohan is the principal investigator, and we have thrombolized 583 patients. Injection worth 30,000 rupees is given free. Then the patient is shifted to the hub hospital. Now we have a stroke. I think doctors from CM are here. Dr. Bhatti is here. He is there. So we have another bone marrow transplant. So government doctor and private doctors are, this is how we are bridging the gap.
Wonderful.
They are training our doctors in critical care also. So we are working together. Ultimately, you see, private doctor will also benefit if he gets the patient when he can cure it. If any stroke patient comes after 3 days, 4 days, then the patient cannot be cured. If he comes within 24 hours, mechanical thrombectomy and patient walks home. I think it goes to the credit of the private doctors also. It benefits everybody. Government benefits, private doctor benefits, and the society benefits. So we are working together.
Yeah, sir, if implemented rightly, it's a win-win situation for sure, sir. Sir, knowing you in person and your passion for both your professions, as a doctor and as a politician, it is commendable. I would come to my last question before I pass it on to her. So my last question for you is, sir, we've spoken about doctors. Now let's talk about doctors in waiting, in line. So the students here. So would Punjab ever see a quota here, wherein KOTA, so wherein students have government specialized facilities to study for NEET, because that's the most difficult exam of our country. We all know that, we all respect that. And secondly, more hospitals, more on the parameters of PGI, sir.
Yeah, definitely. I say it, earn while you learn. So we have started house job where we have increased the stipend from 30,000 to 70,000, and lot of doctors has joined the house job. And now we are going to start an open classroom in which government and the private, both medical colleges are contributing. There will be online classes. Anybody can join from anywhere.
Oh, that's wonderful.
That is in the process in the university. So we will help them prepare for their post-graduation. And they will be, you see, now the 1,000 doctors are joining. We are giving them a choice. You use your specialty and we will post you if you want to be a surgeon. If the lady doctor wants to be a gynecologist or skin specialist, we will give them their respective departments. They can work there. We will train them, and you will be pleased to know that we are starting post-graduation in DNB courses in the government hospitals.
Oh, that's wonderful.
From 30 to, the number has reached 182. It's going to be 250 very soon.
Sir, picking up from your previous question, sir, as a doctor, I want to ask you this, sir. You will understand more than a politician here. So when there is a government initiative and private doctors are supposed to be a part of it, yeah, compulsorily or semi-compulsorily, sir, it puts a lot of added burden onto the doctors. So what special incentives or things that government has in their mind so that doctors are willing and not disgruntled?
We are giving them preferential treatment. We have given them, you see, we have made an exception for the doctor that they get, you see, their next promotion, time-bound scale, after 5 years, 10 years, and 15 years of service. After 15 years service, doctor is getting the same salary as the Chief Secretary of Punjab, even higher than him. And number two, as I already told you, there are many avenues for growth. And now we will be sending them for training, even foreign countries, to the private hospitals, those who want to work with us. But they have to sign
That's
a bond.
good,
We are sending them for super specialization, for specialization at the government expense. So there are many incentives. There is no need why they should be disgruntled. And in, you see, C and D class of cities, we are going to pay them extra in difficult areas. So if the doctor is getting 1 lakh in Ludhiana, if he goes to Taran or any border district, he will be getting 1.5 times salary, 1,40,000 or like something like this.
All right. Okay. Thank you so much, sir.